would say my landing in rheumatology and arthritis was not intentional. I had been most excited in medical school by like pulmonary medicine and critical care and like the super sick individuals. And then I had these grand plans of taking my PhD in immunology and applying it to the lung. And then after I finished medical school and did an intern year, you're supposed to save some of your most interesting cases to present to your fellow trainees in terms of like an intern report or resident report. And after when my first intern report came up, I looked back at all the quote unquote interesting cases that I had seen, and they were all rheumatology cases and there weren't any pulmonary cases. So I realized at that moment that I needed to switch my career goals to go into rheumatology, because that's obviously what like fascinated me the most. I run this ocular rheumatology clinic, so I got a lot of referrals for patients with uveitis and they needed to see a rheumatologist. And commonly I will see a patient that's had uveitis and they get tested for this gene called HLA-B27, which is associated with ankylosing spondylitis and uveitis. And so they get sent to me, and usually the diagnosis is either, relatively straightforward. Either they have something or they don't. But when they do have something, the question that bothers me the most is they ask, well, HLA-B27 is a gene, so are my kids going to get this? And we don't have a good answer for that in the field of rheumatology for these like complex diseases that emerge during adulthood. And so that's the question that's really driving the work that we're doing. So we've started to potentially be able to answer this because we were very lucky to be participating in a international multidisciplinary collaboration that spanned from California to here in St. Louis to Oxford in the UK, as well as to Russia, where we were able to take patient samples from either their joint with ankylosing spondylitis or in the eye from patients with anterior uveitis, and identified actually that there are shared cells in those different tissues from different patients across different countries that actually from the like immune system that target the same thing. And that was a really maybe not surprising but exhilarating finding that there might be a core driver of the disease that's been going on for that we've known about or been hinted at for decades. We are really looking forward to seeing if these are truly the pathogenic cells. Are these the type of cells that might emerge before a person gets this disease, right? So we know from other diseases like rheumatoid arthritis and lupus that the immune system gets a little screwy before the doctors actually recognize that the person has disease, because they have to develop symptoms and have abnormal blood tests. But there's abnormalities in the immune system that precede the diagnosis for years. And so I think looking at these cells more closely and see if they can help us discriminate who may be at risk for developing disease versus those that can't, I think is probably the most exciting thing for us in the lab, because this means that we could catch disease earlier. We could potentially even catch people before they develop disease, and we could theoretically intervene so that maybe their disease course is much milder, or even we could think of creative ways to develop technologies to prevent disease. So that's kind of the moonshot that we're really excited about over the next decade or so. I think it's still a little bit on the horizon in terms of applying sort of our knowledge right now to the future, but I do think that based on the tools that have been developed in the past 5 or 10 years for research purposes, we really this may be a revolution in terms of our ways to both diagnose and treat autoimmune diseases. And that we can, for many, many years, we've had really effective therapies but they're a little bit generic in the sense they target the entire immune system. And so what I really think hopefully they'll revolutionize our field is our ability to not only use new tools to detect the cells that are driving disease, but actually target our therapies just at those cells and not globally at the entire immune system. So I think that's, I think where the field will be. And so if we have, excited participants that are, patients that are really going to be enthusiastic in helping us get there, obviously, because we can't do this alone without participation from our patients, I think we could make a big impact over, the long term.